You are live.
Okay, Will.
I got it.
Oops. Staying in line, guys.
Yeah.
We are live. This is the Senate Education Committee. It's February 7th at 1 o'clock. And we're going to spend the next hour talking with President of UVM, or interim president, just about the state of the school. And we always start, of course, with going around the room and introducing ourselves in part for people who are watching. Probably soon to enter the room in that chair over there will be Senator Ron Hinsdale. And next to her, figuratively speaking, yes, but you're not figuratively.
Not a shame, Senator from Wyndham County. Good to see you.
Dave Weeks, serving Welland County.
Seth Baumgart's Bennington County District.
Terry Williams, Rutland District.
Steve Heffernan, Addison County perspective.
Patty Prelock, interim president of the University of Vermont.
And I'm Wendy Koenig. I'm the executive director of government relations at UVM.
So the floor, my understanding is you don't have a PowerPoint. You're just going to talk to us.
Yes.
Tell us what's going on at UVM.
Sounds good. So first of all, it's a privilege and an honor to serve in my role as interim president, and thank you for your time today. You may not know, but I was the provost and senior vice president for 5.5 years before I moved into the interim president's role. And before that, I was the dean of the College of Nursing and Health Sciences for 10 years. I'm a healthcare professional. I'm an active researcher. My area is autism, and I work with children, adolescents, and adults who have neurodiversity. And I've done this across the state for almost 30 years. So thank you for giving me the time to speak today. The university is stable and continues to thrive. I'm happy to report, and we appreciate your contributions to our success. We're attracting and retaining our most talented Vermont students. Currently, there are 3,664 Vermonters who are at the University of Vermont. That's about 25% of our population. And over 1,014 Vermont students graduated this past May in 2024. About 19% of our students are first generation. We have special programs with first generation students. I actually have the experience of a first generation student myself. More than 1,000 students who graduated in 2024 joined the Vermont workforce. And since 2020, about 4,400 students, both in-state and out-of-state, stayed in Vermont and are working in Vermont. Accessibility and affordability continues to be a priority for the university. Our UVM Promise is a program that's really important to us for Vermont households that earn $100,000 or less. The students get their tuition fully paid. As you might remember, last year that was at $75,000, and we decided to increase that to $100,000.
So just to make sure
Sure.
I understand. So a family with household income of less than 100, tuition is
No
okay.
tuition at
Okay.
UVM. Yep. And more than half of Vermont households are eligible. 46% of our Vermont undergraduates attend tuition free because of the direct financial support we provide, and 91% of our Vermont students receive some scholarship or financial aid. So we have a strong commitment to our Vermont students. Also, I think I'm really proud of the metrics that we have for our Vermont students. Our retention of Vermont students is at 93%. As you know, retaining students and helping them progress is something that's important so that they graduate with less debt. Our percentage of Vermont students who are retained is higher than the entire university, although I'm working towards, it looks like we're going to get it 90%. I'd like to get that to 92. And then our Vermonters will be at 95 or 96. The other thing that's important is them graduating in 4 years. Generally, the metric is 6 years. We're trying to get our students out in 4 years so they can be out in jobs and be supported. 70% of our students graduate in 4 years. That is pretty significant when the national average ranges anywhere from 45% to 55%. And we're in the top 5% of all land grant public institutions who have a graduation rate that high. We're also an economic engine.
Just a question about that. Would it be the case that another 10% graduate in 5 years? Or does it really?
Yeah, great question. Yeah, usually, we usually do 4 years and 6 years. In 6 years, it's about 80% to 82%. So it does pick up. And sometimes it's because students want to do more than one study abroad, or they do an internship, or they take a break and come back. Our goal is always to get them graduated. Yeah, and it really depends on the school and college they're in. Those that have pretty step-wide curriculum, they're usually out in 4 years, unless they decide that they want to take on some additional experiences. I think it's also important to know that UVM is an economic engine for the state. 37,000 of our alumni are actually living and working in the state. And our direct and indirect economic impact is more than $1.3 billion. One of the things that has been really powerful and important is our Office of Engagement. It's sort of UVM's front door to answer questions and work with Vermont leaders, communicators, people in the community who are innovators in all 14 counties in the state. And we're supporting things like 4-H development, agriculture and rural development, research collaborations with rural communities in Vermont, with our new Patrick Leahy Institute for Rural Partnerships. We're giving hundreds of thousands of dollars to communities who have great ideas to solve problems, and they are connected with our researchers on campus so that we can support their success to solve the problems that they are identifying in their community. We have telehealth programs across the state. Preventative care and wellness is an important area. As you've heard about the Tech Hub, $23 million is coming to the state. And although UVM is providing the pass-through, the money is most of the money is going to economic development related to gallium nitride. And this is to create semiconductors. And we have a community with Global Foundries and others that are really working together. And from an education perspective, our community at the University of Vermont is also providing the education for the individuals who need to know how to use build semiconductors and work in those communities. We also have a huge STEM outreach program in our K through 12, from our robotics program, which is quite popular, to other STEM programs. That's just a few of them.
How does that work? You work directly with high schools
We
and
do.
down to the high schools? And
We
help?
do,
Yeah.
yes. And then we sponsor a big event on campus, and they create their robots. Have you ever been to
No,
one?
I haven't.
They're like
Yeah.
amazing,
Yeah.
yes. And even in our College of Engineering and Mathematical Sciences, their capstone project for the seniors, they connect with an industry in Vermont to try and solve a problem. And then they have this amazing night where you can go and see all the things that they're doing in the community. Our Rubenstein School does some similar things in terms of forest, flooding, climate, etc. Most recently, I thought you would be interested in a collaboration that my team and our leadership teams at CCV, Vermont Tech, Vermont State University, we're collaborating with all the nursing programs in the state to address the nursing shortage. As you know, we only graduate about 500 students across the state in nursing, and we need 9,000 over the next 10 years. So the math does not add up. And so I decided that I thought it was really important, and with Wendy's help and other leaders across the state, to get our chancellors, presidents, leaders of nursing programs together. So we met in Montpelier, it was 2 weeks ago, because we're trying to create a nursing consortium and build economies of scale, grow our numbers of nurses that we can train. We realize some people have space, others don't have space. Some have certified clinical simulation labs, others do not. Some have clear pathways for career changers, others do not. So we're trying to work together to see how we can create pathways across the state to increase nurses. And I'm very excited about that effort.
Yesterday, I think the state college just told us that they're graduating 500 nurses a year.
It's between us. It's everybody.
I'm totally work.
Yeah.
I'm totally work.
Yeah,
I
yeah.
misunderstood.
It's between everybody, yes.
I took that too.
Yeah, yeah, it's between everybody, yeah.
Your consortium.
And one of the things that we're thinking about, even Middlebury and St. Michael's that do not have a nursing program are interested in saying, if there's someone who graduates with a bachelor's degree, is there a pathway to get certification as a nurse and then get a master's degree? And we do have that program at the University of Vermont. So we're looking at any way that we can increase nurses, decrease the cost of healthcare, because as you know, travelers cost a significant amount. Yeah.
So there are multiple other states that have these types of nursing consortiums, and we're looking to the other states for best practices and to look at their models and explore those. And the university has put in a request for federal funding to fund this consortium for a year in order to try to build up the ideas and get us across the finish line. But the goal would be to double that nursing output for the state within a 5 to 10 year period.
So do we have the students that want to become?
Yes.
Yeah, so it's a great question. Yes, we have more students than we can take. When I was the dean of nursing, we were graduating about 66, 70 students. And I asked my nursing program, can we double that? So we had some external funding and a donor who said, I'm committed to increasing nurses across the nation, actually. And we increased it when I stepped down as dean. We were at almost 125. So we're now at about 150 nurses that we can take in. But when you have 1,200 applicants, you're really only taking about 10% of that. So one of our challenges is space. We don't have sufficient space. Our clinical simulation lab that we developed when I was dean, we've now outgrown it. There's about 5,000 individuals who go through that each semester, but it is a certified program. So now we're looking at virtual reality and how to use AI technology to help nurses. And we realized that we can help some of the other programs that don't have certified simulation labs, but they have larger spaces. So can we share spaces, increase the number of nurses we can take? We're also looking at our admissions criteria, realizing that there's some differences. And could we do a better job in making it easier for students to move along? Some who want to get an associate's degree, some who eventually want to get a bachelor's degree, and then those who want to get a master's degree. As we know, bachelor's and master's at bedside have more positive outcomes for infection and mortality rates. Yeah.
Are they still accepting associate degrees as RNs? I thought that had changed.
Yeah, the state has identified that a bachelor's degree is what.
Just what you were saying.
Yeah.
Okay.
Yeah. But we can have individuals who are LNAs, so licensed nursing assistants. And then the goal is, if they like it, can we give them a pathway to get a bachelor's degree? Yeah.
My daughter became a nurse and associates from Castleton, then a bachelor's from then Norwich for her master's.
Yeah, that's wonderful. That's wonderful. The other thing that we're looking at, there are a lot of individuals who get degrees in other areas, and then they decide, I want to do something to give back to the community. So we have a pathway program that allows you to have a bachelor's degree in anything. And then your first year, you take all nursing courses, you sit for the national exam, which is called an NCLEX. And then you have another year for a master's degree, but it's a combination hybrid, so you can immediately work in the community, which is really nice. So that's another way to build the workforce. And then they're highly educated. They're coming with, different ideas and background, but good ways to make decisions and problem solve. And that's what we want.
I had a nephew that did.
Yeah.
So does that, those people then become after the first year, they're an RN,
They're an RN.
and then the second year, a master's.
That's right.
Okay.
Yeah.
Yeah.
Exactly.
Is part of the program and part of what, obviously, I assume part of what you're trying to achieve is that they graduate and then stay in Vermont. Do
Exactly.
we have an incentive built in for that to happen?
Yeah, so one of the things that the consortium is working towards, I know there's loan repayment programs. We are working with a hospital to, we've created a residency program for the fourth year student for undergraduates that then they work at the hospital and then will get a job. And so there's a group of students that they take, and a lot of times when they graduate, they're worried that they don't have the skill that they need to be on the floor in critical care or whatever. So that's why we built in some residency opportunities. The other thing is to recruit from within and then send them back out. We're also thinking about helping students across the state who are interested in nursing, knowing it's not just about bedside nursing. Healthcare is going to look different, and it's going to be more primary care and in the communities, school nursing, healthcare in respite places, nursing, all kinds of approaches. So we're trying to expand how we're teaching our nurses. It's not just about being at bedside. There's a lot of other things we need nurses for. The other thing is we do have a doctoral program as nurse practitioners. And because there's a primary care challenge, our nurse practitioners are primary care practitioners. And so that has really relieved some of the stress. And we have both family nurse practitioners as well as adult nurse practitioners. That help?
Oh, yeah, yeah.
All right.
Yeah, sorry for.
No,
Yeah.
this is great. I want it to be a conversation. I do want to share with you a new initiative that we're moving forward on and collaborating with the Vermont Public Health Association, the Vermont Prosperity Project, UVM Health Network, the UVM Medical Center. And that is our planetary health initiative, which aligns well with the legislative list of your last biennium priorities, which was climate change, healthcare, childcare, and housing. The university-wide planetary health initiative is our effort not to create another center or institute, but to bring the centers and institutes in water, health, agroecology together to work across disciplines with our health professionals to really try and solve problems that helps people have healthier lives. So it's really looking at the health of the person is impacted by the health of the environment, and the health of the environment impacts the health of the individual. It kind of motivates careful stewardship of nature, and it's an initiative that will really distinguish us from other institutions because we're all in as a community, and we're hoping that it will be a statewide effort. We're really working in the research end, the educational end. We already have coursework in planetary health, policy support, clinical practice, community outreach. And the goal is at a local level, state, regional, and a global level. It's really a vision for healthy people and healthy planet. And so just to give you some examples of our planetary health research that's going on across campus and that's impacting Vermont. Our Complex Systems Center, which is in the College of Engineering and Mathematical Sciences, is examining students and individuals' time in nature and how does it decrease their blood pressure and their stress. And they're finding that time in nature has a greater reduction in blood pressure and stress than even therapy and exercise. So that's an important piece about the value of the environment that we're in. The second thing is the Larner College of Medicine has been examining the impact of forest fires. As you know, much of the smoke and wildfires from Quebec and others have impacted us, and there's been an increase in asthma in Vermont, and they're looking at the relationship between wildfires and childhood asthma, and also the impact of flooding in the area and decreased access to healthcare when roads are flooded out and people can't get consistent cancer treatments or other treatments that they need. In the Rubenstein School, they're looking at the importance of nature in mental health during COVID. And in the College of Arts and Sciences and Extension, we're looking at the wetlands, water quality, the whole impact of algae blooms on human exposure to disease. And the College of Agriculture and Life Sciences is looking at the impact of climate on malnutrition. And our Gund Institute is examining forests on children's health at global level. So we know that forests provide increased food security and nutrition, increased well-being, but also edible products that lead to healthy living, like fruits, leaves, nuts, seeds, mushrooms, honey, etc. So I think the whole goal of the Planetary Health Initiative is really the policy message is we're conserving nature as an investment in public health and sustainability efforts to deliver health benefits. And from an education perspective, if we can educate our students in understanding that and bring our researchers together, that they will be good stewards of both their own health and the health of the environment. So my goal this year is really just to educate people in the state on this effort, and then we'll work collaboratively over the next year to address health, water challenges, pollution, and food systems, and how to educate the workforce that could be responsive to that. So any questions? Because I'm going to conclude with what our financial asks are for this year. Yes.
You used to have a Center for Rural Medicine that taught EMTs.
Yes.
You still have that?
We still do.
Yep.
And this is an important part of
Yeah.
our community efforts. And that was also in the College of Nursing Health Sciences when I was there. And we're educating EMTs across the state, as well as a lot of our students who are nurses, who are studying exercise science, et cetera, are also getting certification as EMTs. And then many of them who do go on to med school as well. But we also have biologists and environmentalists. We have a wilderness program, and they're becoming EMTs as well, so that when they're out in the field, they know how to support a person who's in distress.
Great.
Yeah.
Thank you.
Yeah.
Does that program reach down to Southern Vermont? Or is it
Yes, it does. It's all across the state.
how? But because it's virtual or because?
They do virtual, they do summer, they do residential, and then we've trained people who are EMT advanced specialists who can then do the education across the state.
And a paramedic program.
Yes, so they're working on, yeah. So those are the things that we don't have a specific one at UVM, but they have the paramedic training. Yes, that is a statewide effort, which is really important. All right. Yes,
Right. You want to start correctly before you get into the financial.
it's up to you. Whatever you would
So
like.
yeah, a bunch of questions. So I think you said 3/4 of your students are out of state.
They are.
How do you attribute that success? What do you attribute that success to at the university?
To bringing the students? Yeah. So that's a wonderful question. I think students come here for the values that we provide at UVM. I think this place is important to them. Students who are interested in the environment and well-being. I think having a medical school is a huge draw for us in bringing students together. I think we've done some really strategic recruitment. We put recruiters in Chicago, San Francisco, Atlanta, Pennsylvania to really bring students from out of state that we hope then will stay in Vermont once you come here. You've got to love it. And also recognizing the demographic cliff that we have in Vermont. The university can't survive when you have 7,200 students who graduated in 2010 and 5,100 who graduated in 2020. That's not a sustainable model for our university. But it's also wonderful to bring a diversity of perspectives and views from all 50 states and countries. And we're increasing our number of international students as well. And I think they feel like they're coming. They get a good academic experience, and then there's an opportunity to give back. We were just named the #1 school for making an impact by the 2025 Princeton Review, which is huge. That's the students' assessment of, I go there because I think I can make a difference, which is what we want. That's so the ethos of Vermont.
And I mean, if we're being very practical and honest, having that many out-of-state students makes it possible for us to financially support Vermont students in the way that we do.
Absolutely.
Yeah.
Absolutely.
Go ahead, just run.
Well, I have a list. I don't.
Fine.
Marketing. So what's your marketing budget? And so,
It's a good question.
because we're trying to compare this to, in economic development, compare it to what the state spends. It would be
Yeah.
interesting to know what you spend.
Yeah, not enough. I'm looking at a different model for marketing. Because I think that, we never had a strategic communications and marketing group, until I think when President Garamella came, we had been talking about, enrollment management did it. But so we developed a strategic communications team. They're still struggling to figure out how to work to make sure that our brand that is all across campus. But what I have is I've created a new model of what we call marketing, recruitment, and admissions for both undergraduate and graduate students. And the machine that works well for us is our undergraduate enrollment management. So we've now put graduate student enrollment there. And we're doing for the first time a model for financial aid packages that we've never done at the graduate level, because we do have to build our graduate program since we're going to be pretty much leveled off with the demographic but for undergraduates. So, it's hard to say we pull from different places in terms of a couple of $1 million in it, but I know institutions that put $10 million in their marketing budget. We don't have that to do that. So I'm trying to look at economies of scale and see how I can use what is on campus and build from what I have. So it's part of that.
Have you ever gone into the state of Vermont marketing pages and seeing if you're represented, or do you know if you're represented?
I haven't.
That's a really good question. I'd have to, well, I know my enrollment management vice provost would probably know. I know they do some things. Some groups do more on VPR and other things, but I think they're doing more hands-on people, boots on the ground. We're finding that for undergraduates, that makes a difference. So one of the things we're thinking about is increasing our summer programs and giving opportunities for young people, junior, senior, high school students to have an experience at UVM. We're looking at the possibility of creating an entrepreneurship studies program for young people to take some coursework in the summer, and expanding our summer programs that we've never seriously looked at. It's beautiful on campus in the summer. We should be using it more. And this is a great opportunity to bring students from across the state for camps. We're increasing our summer academy program for students who might be interested in healthcare and robotics and computer science, those kinds of things. So I have a whole task force that's working on increasing summer access.
Just to follow up on that a little bit, can high school students, programs where like a student between their junior and senior year in high school can go to the campus in the summer and actually get credit?
They can. We have a dual enrollment program. And that works. Although I had a young person who's a 17-year-old who's a junior, and she said, Dr. Prelock, what about early college? And I said, let me work on that. She's taking calculus at UVM. She's taking computer science. She's doing a biomedical course. Her ultimate goal is to become a physician, but she's working in a histology lab. And so I said, okay, I love what you're thinking about, but it has to also be something that financially we can manage and support. Right now, dual enrollment is like 50%.
And the VTSU has done early college for a long time, and we haven't. And a lot of that has been a lack of space that we've had and a lack of capacity, but
we have a residential director who's looking at things differently, who's allowing us to have a little more freedom to think about how we can manage our space. At the same time, when you let students graduate, you have to renovate dorms, you have to support so that you can get ready for the next class. But he now has a 10-year plan that will allow us to have summer programming, and we've never centralized it. For the first time, we're
To that point, because I was thinking, I think this is where Southeast was partially headed, is if obviously then get them there for a summer and then they want to come,
Right.
then they.
That's
and they're-
exactly right.
I remember going to the campus when I was, 18 and being terrified by
Yeah,
the size.
yeah.
Get used to it one
Right.
summer.
Yeah.
Well, we do have a lot of,
Demystifies it.
yeah, it does. And we do have a lot of sports camps, and of course, with our soccer team winning the national championship, that helps. And what we're trying to help them see is not only playing sports, but being a student who gets a degree. Many of 8 of our soccer players are in graduate school and getting graduate degrees, and they're in biomedical engineering and political science and exercise science and doing all kinds of really good work. So I think those are things that we can continue to do. One other thing that we have initiated is what we call a UVM Go program. And we're trying to get students to feel more comfortable experiencing a global framework. And so if a student enrolls at UVM before they even come on campus, they can apply to a program with a faculty member and go to Montreal or Vancouver or Costa Rica or Iceland, or this year we're adding London, and then major cities that have global connections like DC and Chicago, New York City, San Francisco, to help them see the possibilities of what's happening in each of those cities so that when they come back to Vermont, it's not so scary. And then for those who are just not sure they want to travel, they can come early to Vermont campus. And then we do things all across the state.
Yeah, that's good. So
International students, what percentage would you say? And is it on the rise? Is it dropping? Is it
Yeah.
flat?
There was a significant drop after COVID, as you might imagine. We've never had a significantly large percentage of international students. Our goal is at the undergraduate level is to grow it to about 3%. We were at like 0.03. We're now at almost 3% for international students. They're the hardest to yield, but at the graduate level, our goal is about 15%. And the last 2 classes have had a significant percentage of international graduate students, and they actually have loved the experience. What we learn is when you bring graduate students, then they tell members of their country, this is a really good experience. We do have a pretty vital exchange program. And about 30% of our students do study abroad as well, which is a great way for us to make connections. And we have a new global partnership and program individuals. So we're working with people in Nigeria, Kenya, in India, in Korea, in Auckland and Galway. So yeah, we're trying to increase that. We've had a significant increase of applicants to the point of like 45% increase in applicants and graduate international, as well as undergraduate students.
Excellent. Do you track students into employment? Like, do
We
you
do.
keep those?
Yeah, so we look at
Those out?
careers. So 92 or 93% of our students within 6 months of graduation are either in graduate school or they're in a job. And they're very satisfied with the job that they have.
Do you track them as tracking into whatever their discipline was?
Yes, good question. So is my job related to my discipline? Is it exactly what I wanted to study and not? And there's a significant percentage in the 90s where it's related to their discipline. There's only a very small percentage where it's not. But for our arts and sciences student, it's interesting because for them, whether you're in history, art, political science, sociology, you can be a lawyer. You can be a doctor, you can be the head of a nonprofit, you can go into business, etc. And you should know in our business school, they are ranked #1 in the nation for a sustainable green business and #2 in the world for sustainable business. So we've seen an increase in our business students. And actually, I think there were 11 of our soccer players who are in business school.
Do you have programs that you're seeing that are on the increase and programs and the flip side, programs which are declining and any
Yeah.
of those?
Yeah, it goes up and down. Interesting. We're seeing an increase this year in the health sciences, which is nice. We saw a little dip right after COVID. May have been because of the stress of that experience, but that seems to be on the rise. Normally, computer science is really high. We've seen a dip this year, but we think the students think, well, with AI, you don't need coders anymore. So what we're trying to reframe is, oh my, yes, you need people who can analyze the data and feed the data. So it's helping students rethink computer science because now it's really complex systems and how to understand that. So it goes up and down. The environment is always pretty high.
Nursing.
Yeah, nursing, it's a little down. Ag, animal science is pretty much grown a lot, but it ebbs and flows. When we see a decrease, we look at what is the national framing too.
Yeah, that wouldn't be a criticism necessarily.
Yeah, no,
Just,
no,
I'm
yeah.
curious about.
Yeah.
What,
a
well,
trend.
and also you want to think about what are students interested in, and also we need to be edgy in terms of what are the kinds of programs that we need to develop.
I need to mention that we are due in appropriations in 5 minutes.
Okay, so I know you've got something you want to talk about.
All right.
I'm sorry to interrupt.
Yeah,
Sorry
it
about
was, no, it was great to have this conversation. Thank you. So I just wanted to share with you our financial asks for this year. Your previous support has really allowed us to really invest in Vermont student scholarships in agriculture and extension and in the College of Medicine. And this year we have 3 primary asks. The first ask is probably not a surprise to you. It was in Governor Scott's budget, and that is the 3% increase in base funding that we would like to receive. And this will really help us to continue our investment in Vermont students in the state of Vermont related to agriculture, extension, and medicine. Then we're asking for 2 one-time funds. The first one is $1 million for the Tech Hub, which will be matched by Global Foundries. As I mentioned, we just got a significant grant that is going back to Vermont, the Vermont economy, from the federal dollars to assist Vermont companies that want to get started in gallium nitride, which is really an important technology for semiconductors. This will help us support economic and workforce development from an education perspective. It then gives us the opportunity to educate and train the individuals who need to be able to work in these companies and understand these gallium nitride semiconductors, et cetera. And the Tech Hub dollars, they're looking at how is the state committed as well. That's how you get additional dollars. Is there an investment in your own economic development? And the second one is a $5 million ask over 5 years, so $1 million a year for the Vermont Cancer Center initiative. And we're asking for this because, as you know, cancer disease is really heightened in rural communities. And there are 3 particular cancers that are significant in Vermont, and more so than in other rural communities. And that's melanoma, lung cancer, and breast cancer. And we are going for NCI designation, which is the highest designation of a cancer center that then allows them to qualify for funding from the NCI. Right now, they don't qualify for certain funds until they get this designation. But their question is always, what is the university putting forward? What is this state putting forward if we're going to continue to fund you? And then it also helps us bring in new researchers who are really doing things that are meaningful. And for us, we're focusing on the rural communities and cancer in rural communities, which actually has a direct relationship to our planetary health initiative too.
Since we know you need to go, it'd be great to get that you're asking about.
Yes, absolutely.
happy to do
We'd be
it.
happy to do that.
But
Yes.
it remind us and give us a little bit of
Yes.
detail on what you said.
Yes.
It's true, since we have 20 seconds. Do you have any satellite campuses?
We do not have
Yeah,
that.
have you ever considered that model is to kind of spread the brand?
Yeah, it's an interesting question. It's a conversation. Oh,
Hi.
we should. Oh.
No.
Yeah. We know each other. Yeah. It's an interesting thing for us to think about. We're kind of a residential campus. But I think if we did anything satellite, it would be much more, how can we create hybrid models with international groups? So India is very interested in our sustainable business model. So are there ways that we can work with them to develop programming there? Same in Africa. They're very interested in our student affairs development program. And so we're looking at, they're just now this concept of student affairs in higher education in Nigeria, Kenya, they never had before. And so now they're sending a lot of their students to us. And so is there a way that we could do something with them in country? Would be interesting. At a national level, it would have to be a very strategic and thoughtful move. Right now, we have an OSHA Center for Integrative Health. There are only 11 in the world, and we're one of them. 10 are in the United States. So we're trying to utilize our non-pharmacological approaches to healthcare and support with these other institutions, which are Northwestern, Harvard, the University of Washington, the University of Florida, Wisconsin, et cetera. And are there ways that we can learn from each other? And they're liking some of the unique things we're doing in Vermont that we can do in these other campuses and areas. It's an interesting question.
You
Yeah.
need to go.
We need to go.
Sorry.
Anytime you want to communicate with us, or,
Thank you. This was-
Wendy or me, I'm happy to. Yeah.
This was great. Thank you.
Yeah.
Thank you very much.
Start teaching the Simba program.
So,
Oh,
And I have some limited connections
for
to
people
India.
watching, we're gonna go off for a bit.